Normal blood pressure is a blood pressure less than 120/80 is kind of the golden number that everybody knows. That range of 130 to about 139/80 to 89 is this pre-hypertension range where we're kind of paying attention. We want to kind of know what's going on with that number. If that number continues to go up to greater than 140/90, then you get a diagnosis of hypertension. And so that's when we really start talking about medications. But before we get to medications, are there things that we can do in this pre-hypertension stage that can help us prevent going to this, I need medications for my blood pressure? Unfortunately, there are things that we can do. For people who are overweight or in the obese category, we know that even just 1 pound of weight loss can lower a number by 1 point, systolic blood pressure by 1 point. And so if you've got 20 pounds to lose and your blood pressure is creeping up there, we can help drop that blood pressure pretty significantly with weight loss. Following a low sodium diet is really important. We also want to think about what you're eating, the foods that you're eating. And so important for hypertension is following something called maybe a DASH diet. Some people have heard of that, which is really high in fruits and vegetables and whole grains and lean meats like fish and chicken rather than your red meats, kind of trying to avoid those and avoiding a lot of fat in your diet. Even if you don't lose weight by exercising, the exercise itself is important because it's good for your cardiovascular health and can help reduce your numbers. Even if you're not losing weight with your exercise, just being in the habit of getting 30 to 40 minutes most days of the week of cardiovascular exercise, so doing some aerobic exercise, whether that's just walking every day, can help reduce your blood pressure numbers. It's really important to know your numbers. If you are between the ages of 18 and 39 and the last time you had your blood pressure checked and it was in the normal range, so somewhere in that 120/80 range, then every 2 to 3 years is okay to have your blood pressure checked. But if you're in that higher category of 130/80 to 90, then we need to be checking your blood pressure yearly. And if over the age of 40, then we need to be checking your blood pressure every year.